Okay, this is your brief lecture on Chapter 12, which is Social Work in Healthcare. Um, First off, just to define health. Health state of physical, mental, and social well-being. It's important to focus on the well-being, not merely the absence of disease, because you could have the absence of disease and not be in a good place, okay, not be in good health. Health problems could be basically any malfunction of us in a physical sense or an injury, disease, almost anything like that. So what do medical social workers do? Typically, they're going to work in hospital and diagnostic centers, treatment centers, and things like that. Help patients understand and interpret the technical medical speech. Okay, not only to understand what the doctor is saying to you, but to represent themselves. Okay, um, if you've ever been to a doctor's office, you may have waited out in the waiting room and then you were taken to a different place and probably somebody took your vital signs and then they made you wait again and the doctor comes in and if you weren't pretty lucky, the doctor talked to you for 2 or 3 minutes and then said, okay, you got any more questions for me? No? Okay, well, have a good day. I'll phone in that prescription for you and you're done. And after they leave, you're like, oh, I have 17 different questions and I was a little bit intimidated and I didn't ask. Or if you did ask, the doctor talked back to you and used the medical jargon that you didn't necessarily understand. But you don't want to admit you don't understand it because that's a little bit embarrassing. Social workers can step in at that particular point and act as an interpreter because most likely they're going to work with the doctors enough that they can start to understand the medical jargon, but also not be intimidating and let the people have a bigger chance to breathe and actually express their concerns and ask their questions and things like that. Offer emotional support. Dealing with illness is scary, okay? And many times whenever we're dealing with that, people do need emotional support. If somebody's given a terminal diagnosis, helping people deal with end-of-life plans, whether that's a living will or a do not resuscitate paperwork or things like that. Typically not working inside the hospital but outside the hospital, social workers can help patients adjust to their new lifestyles because sometimes their life may have drastically changed and there is going to be an adjustment period to that. Social workers can work and help parents of children who have serious illnesses or disabilities, help them to understand their children better, help them to help their children better. Okay? I talked about serving as a go-between between patients and a doctor, but also serving as a go-between patients and community resources, also helping make arrangements to help pay with medical bills, and people may not realize that payment plans are available and things like that. And then providing education aimed at improving your health or establishing a more healthy lifestyle. We use the term public health for all the things that are kind of related to health in a general macro sense, okay? Some of the goals of public health is to obviously prevent disease and prolong life, improve sanitation because we know that that's one of the ways that diseases spread, okay? Educate about personal hygiene and make sure that everyone is kind of on the same page with that. To ensure a standard of living so that everyone can be as healthy as they possibly can be. Some of these same macro approaches also point out some, in many ways, devastating problems. Okay? Escalating costs of healthcare. It's estimated that seniors in the United States will spend upwards of 40% of their income on healthcare. Okay? If you think about right now, you're probably much younger than that. Imagine losing 40% of your income off the top before you ever get it because it's got to pay for healthcare. And healthcare is not an option, or it should not be an option like do I do it or do I not pay for it. Unequal access to healthcare based almost solely on income or geography. This is a problem in Texas more so than many other places because we're so spread out. There are people in Texas that may live 2 hours from the nearest healthcare facility. Problems in managed care and ethical dilemmas. The ethical dilemmas typically we think of in managed care is, does a business do what's right for the business or do they do what's right for the individuals that they're serving? And many times it comes down to money. And those can present some very serious ethical dilemmas. Cultural competence in the U.S. healthcare system. A lot of times we have very rigid rules that don't allow for flexibility when dealing with people from different cultures. And people from different cultures may approach healthcare very differently. Okay, some examples of this could be collective versus individual decision making. In your family, maybe if your mother is given a diagnosis like you have cancer and you're probably going to die within 9 months, that may be mom's decision, like, do I want treatment or not? Or it may be a family decision that everyone gets to speak up, and your family's culture might be different than my family's culture, okay? Some cultures may have extreme shame in just simply asking for help at all. As social workers, we need to be aware of these cultural differences between our clients and educate ourselves to work with them as best we can, okay? Maybe we need to provide training for the other professionals in order so that they can understand cultural competence and become better doctors or nurses or whatever their particular role is. Becoming more family and less individual-centered. Sometimes whenever we're making these decisions, in the United States, we are a very individualistic society, so we approach all problems that way. But many other places don't, and they involve many more people in that decision-making process. I realize that this lecture has been very brief, but I hope it's given you a couple of things to think about as you're reading through the chapter. If you have points of confusion in the chapter, please don't hesitate to contact me about that, and I will do my best to answer whatever question you might have.